Surgeons of Reddit, what has been your biggest "oh shit" moment? Way back in the day, preoperative preparation was done with alcohol-based cleaners. Naked, sedated guy with a light sheen of cleaning fluid on him plus static electric spark riven fully engulfed in flames. Everyone just stood there for a second till someone grabbed a sheet and put out the flames. Surgery went well, no complications, slight suntan. This one's from my dad. We were putting up a central line for a drip with an 18G needle. 1.2 of a millimeter, relatively big compared to most needles, in the patient's external jugular, and all of a sudden the needle went right into the jugular. We all started panicking because usually with a drip the needle is meant to come out and only the plastic remains, but now we had lost the needle inside this guy's jugular. Before we could even fish it out, it was gone. I looked at the fellow surgeons and nurses, and before we could do anything we rushed him right into theater. After a few minutes we fished the needle out near his subclavian vein closer towards the shoulder, and we breathed a sigh of relief. I wasn't present for this, but I got to deal with the fallout. Client brings his cat, found as a stray, to be spayed. The veterinarian, my boss, preps cat for surgery and begins cutting, and can't find the uterus or ovaries. Oh. Cat is a male, and poor kitty just had his belly sliced open for no reason whatsoever. The owner was, understandably, furious. I was a junior doctor working in neurosurgery back in the 2008 when one of the senior registrars, I suppose the equivalent is chief resident in the United States of America, told me his most unfortunate moment. In order to have a patient's head stabilized for surgery, he was using a frame that had a set of 3 spikes that held the head in place. Due to the angle he needed to approach from, this required the patient to be face down. As he was placing the head of the anesthetized patient onto the frame, the head slipped and his eye landed onto the spike, perforating the eyeball. Panicking and thinking that his career was now over, he then rather bizarrely started poking at the eyeball, trying to work out what was what until the anesthetist told him to stop. They then called the ophthalmologist, who came to tidy up what was now a completely ruined eye. After the surgery, terrified, he went to explain to the patient what had happened. Understandably fearing the worst, anger, distress, and tears, received the response of, "That's okay, I was blind in that eye anyway." Luckiest bastard ever. Surgeon perforates patient's eye by mistake. Patient doesn't care. I woke up during the last part of my gallbladder removal. I felt this pressure as my surgeon had him for a prior operation. Funny guy was trying to close one of the wounds. I lifted my head, we locked eyes, and he had this startled. "Oh fuck. Look." Then he snapped back to normal, said, "Patient's up." And the anesthetist was on that shit. Woke up an hour later in recovery. I was in charge in the unit the other day, and this happened. We had a patient in the intensive care unit who had some big abdomen trauma. He had gone to the operational and was too sick to be able to close his abdomen, so we left it open. We had a piece of plastic covering, like a bag, covering his intestines, and then we placed a vacuum sponge dressing on top of that, called a wound vac. The patient's nurse called me into the room to look at the abdomen because she thought she saw pieces of the bowel seeping out of the bag and getting sucked against the wound vac. I agreed and thought the bowel looked pretty dusky as well, so we called the doc to come and look at it. The resident agreed and talked to his attending, who told him to take the wound vac off, tuck the bowel back into the bag it had escaped from, and put a new wound vac on. It all just sounded like it was going to be a disaster, but whatever. So, resident comes in, takes off the wound vac, and the bowels had become very swollen from the fluids, trauma, etc. So when he took the wound vac off, they all slipped out of the patient. The bag had dislodged significantly. We would tuck the bowels in one side, they'd spill out the other. Here we had this guy in his bed, disemboweling, and we simply could not get everything back in him, in the bag, or anything. Luckily, the drugs we had the patient on kept him very nicely sedated, and we had other drugs to control any problems with his blood pressure, and the guy wasn't overtly bleeding. It was messy. We really just had to step back and say, "Well shit, how do we get this guy's guts back inside him?" Ended up having to call in 6 other people to help tuck things here and there until he could get back to the operational for them to get everything back into its proper place. Guts. Guts everywhere. He had a friend with a swollen area on his lower back where it got to the point where he could barely sit. So he goes to his family doctor. The doc says, "Yay, that's a pilonidal cyst. We should probably go ahead and take care of that." He told my friend to take off his shirt and lay flat on his stomach. So he's laying there and waiting, and the doctor says you're going to feel a poke, and is at this point expecting a local. Well, first it turns out the poke was actually a scalpel, not a local. He said it basically felt like someone took a fire-hot poker and drove it into his back. He then hears the doctor exclaim, "Oh boy, we have a pumper," just as he feels warm blood and pus now pouring all over his back. The nurse's face, which was the only thing he could see, went from a warm smile to what he termed as pure and unadulterated fear, as the doctor is screaming for her to get gauze and towels. The doctor climbed up and laid on his back to apply pressure for about 10 minutes until the bleeding stopped. So yeah, I'm hoping I never get one of those. Not quite a surgeon, but somewhat medical. I was bisecting someone's leg deceased, and I did not know that said person had a metal rod through their femur. Proceed to cut through the bone with a metal saw. Sparks fly and my blade broke. Luckily I was standing off to the side, instead of directly behind the blade, as it flew backwards and hit the wall. The clothes the person had been wearing were lying underneath the body and caught a spark. I doused it with a water hose before a large flame could start, but still an "oh shit" moment. Patient here, but I have a good "oh shit" surgery story. When I was 18, I was told to get my impacted wisdom teeth removed. I went to a surgeon who informed me that they were pretty much formed and I would be put on general anesthetic totally asleep, and the teeth would be broken up to be removed. Day of surgery, I go in. Because of how fucked up you get on anesthetic, my mother was scheduled to pick me up after a couple of hours. She arrived and was informed that I was still in surgery. After nearly another 2 hours of waiting, she felt like something wasn't right and called my father. He came in and was likewise informed I was still in surgery. At some point they finally said they wanted to see me and threatened to call the cops. It was then revealed that my jaw had been broken. Instead of breaking up my wisdom teeth, the surgeon had tried to take them out in one piece, and on the very first tooth he snapped my mandible. It popped up into the muscles in the back part of my cheek, coming up against 2 nerves, trigeminal and facial. He wired it shut in a panic, without consent or Roentgen. Turns out the reason you take an Roentgen is because you need to make sure the bone is set. My bone was not set. Over the course of the next 2 weeks, the bone didn't heal because it wasn't set correctly, and instead it slowly sawed through my trigeminal nerve, destroying sensation in the lower right half of my face. I looked like a stroke victim because I had very little control over it. It's since gotten better and moves more or less with the rest of my face, but I don't have as much control there as I should, and sometimes I bite it and do a lot of damage since I can't feel it. This was probably the most pain I've ever been in my entire life. I took liquid Vicodin, remember, jaw wired shut. Every 2 hours could barely sleep and needed help with tasks like walking upstairs and going to the bathroom because of the pain and the drugs. It was hell on earth. We eventually found a doctor to fix it. He had to reset the bone. This was about a 6-hour surgery and a 2-night hospital stay. The bone was so badly out of whack that it needed a plate and 7 screws installed to stabilize it. My jaw was wired another 10 weeks while that healed, and of course the nerve damage is permanent. You can definitely tell which side was busted from both the surgery scar and the lopsided smile. The original doctor who broke it refused to admit responsibility or pay any of the damages. Presumably he was told by malpractice lawyers never to admit to fucking up, so I sued for that. In the deposition he said he broke up the tooth, which of course he hadn't. I had the tooth to prove he was lying, after which we settled for the amount of damage. But about 75% of it ended up going to things like lawyer fees, so I still came out behind on all that. But I have a wicked scar on my neck from the surgery, and my other 3 wisdom teeth, 2 of which cut through. Yay. So I got that going for me, which is nice. I doubt you'll get too many real stories. Mine is extremely rare, as I was the patient, but awake for the surgery. I was supposed to have a bump on my back removed. Nothing huge, just a lump of some kind. For insurance reasons they did it as an ambulatory in the operating of a hospital instead of the surgeon's actual office. So, I'm wide awake, face down in the operating. I had picked him as my surgeon, because his main practice was plastic surgery. At the time I lifted weights a lot and spent a lot of time working my back. I wanted as small a scar as possible. I was vain. He begins with the first incision. Then goes for a second, larger. Then goes deeper, I guess, and realizes the bump is just the extruding tip of a cyst that cut through my back to the back of my lungs. He wasn't used to operating on alert patients. As soon as he realizes, he just says, "Oh fuck." That was the beginning of a 4-hour surgery for which I was awake. What they cut out of me was the size of an adult fist. In closing the wound, they drew in so much flesh, for lack of a better word because of my lack of medical understanding, that my right arm became essentially inflexible. I couldn't lift weights for years. All that precious work shot down the drain. What an asshole I was. I was rounding a few months back and a guy gets wheeled into intensive care unit smelling terrible. I walked over and the dude had maybe the most macerated legs I have ever seen. There were things moving on the bed and the suction container was full of maggots. Turns out dude had been weaving on the road, and when police pulled him over and opened the doors, maggots fell onto the road. He got taken to the emergency department, arrested, taken up to intensive care unit, and very rapidly debrided, then bilateral above knee amputated. He actually made it out of the hospital, but I cannot imagine waking up one day and having no legs. I really wish I knew where he was driving, though. Not a surgeon, but I was observing a hand surgery about a year ago at a teaching hospital. The surgeon was removing one of the carpals, the bones near the base of the hand, to be used later. A nurse was given the carpal to hold until it needed to be used. She ended up dropping the patient's bone on the ground. I broke my wrist once, and the broken bone had to be surgically adjusted so it would grow to be a nice and functioning one again. It appeared to be an easy and uncomplicated procedure, and 2 hours later I woke up with a cast around my arm being told everything went fine. A couple of weeks later I returned to the surgeon who performed the surgery to have the cast removed. As soon as he took it off, he had a confused look on his face. I could see him think, "Shit," and he told me perhaps it didn't go exactly as planned. The two parts of the bone weren't placed in a straight line during surgery, so after a couple of weeks in a cast my arm was now really funny looking and crooked. The arm had to be manually broken again and put in a bit more of a straight position. Few weeks and a wicked looking scar later everything was okay again. When I was a medic, I worked in the emergency room one night, and this huge dude, maybe 350 pounds, came in from a car accident with the paramedics giving him artificial respiration. We got to doing our job when it was decided that he would have to go to the operating as he eventually went asystole flatlined. I was new and my knowledge was pretty limited at the time, but I believe they were going to massage this guy's heart. I was pretty relieved since we were all taking turns pumping this big-ass man's blood for him and we were beat. Shortly after he left I was talking to some of the medics docs and they said that it would be a great experience for me to watch it in the operating room. So I scrubbed up really quick and went in to watch in the back, and they were already about to start cutting this guy open. I watched in excitement as they were cutting through everything when suddenly, blood burst out of this guy like a pot boiling over. There was more blood than I have ever seen, and hopefully will never see again. I don't remember anyone saying, "Oh shit," but I remember everyone getting really quiet. The staff stepping back as the blood flowed out of him, on the table, falling on the floor and crept until it got a couple feet away from me. I was like 6-8 feet away. Most of them were standing in the lake of blood when it stopped. The surgeons said that it looked like at least 3 liters of blood that came out of him. They hadn't seen that much blood come out at once either. It looked like some kind of Japanese horror scene afterwards, and I think I was in shock because I felt so weird and out of place afterwards, watching them clean him back up. Later on, I ended up finding out that upon a closer look to the Roentgen it showed that the man's poor sternum gave way either from his chest hitting the steering wheel, yeah, he had no seatbelt on, the firefighters, paramedics, or our cardiopulmonary resuscitation. The bone had splintered and punctured into his major vessels, aorta, pulmonary vein, artery, so we were pumping blood into his pericardium heart sac, and that was what exploded when they cut him open. So there was little we could do to save this man's life. After that episode I never was bothered by the sight of massive blood loss, since I don't think you could see any more than that come out of a person. Blood. So much blood. When I was in residency, my first solo procedure was a spinal surgery on a 16-year-old kid, a girl. And at the end, after 13 hours, I was closing her up and I accidentally ripped her dural sac, shredded the base of the spine where all the nerves come together, membrane as thin as tissue. And so it ripped open and the nerves just spilled out of her like angel hair pasta, spinal fluid flowing out of her and the terror was just so crazy, so real. And I knew I had to deal with it, so I just made a choice. I'd let the fear in, let it take over, let it do its thing, but only for 5 seconds, that's all I was going to give it. So I started to count. 1, 2, 3, 4, 5. Then it was gone. I went back to work, sewed her up, and she was fine. When my nurse accidentally gave my patient a lower dose of anesthesia during a heart surgery I was performing, and the patient opened his eyes and screamed during the operation, so we had to stop it. Scary shit. Story from my vet. He was in a super run-down barn with a pregnant mare in trouble. She'd been getting up, lying down, and getting up again, but nothing was happening. Horse births are hell on earth, his words, because the foal doesn't turn until minutes before birth is supposed to happen. And if they're in the wrong position, it's nothing in there but rigid legs and sharp little hooves, and good luck getting that repositioned with 1,000 pounds of frightened horseflesh in pain on your arm. So there he is, at night, up to his elbow in this frightened mare. She's not really into what's going on and doesn't want to stand for it. He's not terribly fleet of foot in that position, so it's up to the owner at her head to keep her calm, and that person is doing the best she can. Keep in mind this barn is in horrible shape. Really just a dilapidated health hazard. Well, the mare decided she'd had enough and tried to walk through the owner. I'm guessing there was a stud chain involved, a metal chain that loops around the nose, jaw, over the gums, or however you want to attach it so that you have more persuasive power over the horse. The owner was shoved off balance and managed to grab a live, uncovered wire. Why there was one in a barn I will never understand, but the result was that current flowed through her to the horse and into my vet. So now the poor guy is elbow deep in a terrified mare while both of them and the owner are being electrocuted. He didn't tell us how he got out of that, but the mare was okay and she delivered a live foal. He named the filly Electra. And that was when I first began to think maybe I didn't want to be a horse vet after all. This is less. Oh shit, scary and more. Oh shit. Shit. As a medical student, I got to assist in the repair of a vaginal anal fistula, basically a connection between the two that meant the poor patient was leaking shit out of her vagina. Given the nature of the operation, the operating room smelt so horrific the anesthetist actually had to leave because they were dry heaving so much. Towards the end of the operation, we had to flush out the remains of the colon, and so I flushed saline through whilst the consultant surgeon stood at the end of the table with a bin bag. Once we were done, the surgeon looked at me with a totally defeated look in his eyes, up to his elbows in shit, and said, "I have a really fucking glamorous job." So that is my, oh shit, moment. I asked my grandfather, a surgeon of 30+ years, this exact question once. He told me a story about opening a patient up to fix something serious with his aorta. It's been 10 years since I heard the story. Details a bit hazy. Anyway, he and the other surgeon, who happened to be my mom's godfather, opened the guy up for this dicey operation and found several significant tumors. Like, well, shit, this guy is toast, tumors. He said he'd never seen so much cancer. They went out to tell the family, went back in, and as they were trying to figure out what to do, the aorta dissected, and he bled out with the two of them shouting and trying to clamp it. He said it was over in seconds. He felt bad, but the guy was facing a pretty painful death anyway. He figured that there was less suffering that way, but secretly I think he was upset that they couldn't save him. I performed a cesarean section on a hefty woman once. Everything was happening fine and I took the baby out and stitched the woman up. I found out later that day that the hefty woman was pregnant with twins and I forgot one of the babies inside her. Not a surgical story, and over 30 years ago, but knew a cardiologist treating someone for psoriasis, a skin condition usually, like never, treated by a cardiologist. But he was Asian and the patient was Asian, and probably sought someone she thought she could trust. Anyway, he prescribes 3 doses of methotrexate, which is both a medication prescribed for psoriasis, in small doses, and for leukemia and breast cancer. As you can probably guess, he prescribed 3 doses of the total dose rather than the total dose divided into 3 small doses. Everyone was familiar with doses for cancer treatment, but not for psoriasis. The pharmacist didn't catch it and the nurse didn't catch it. The patient became very ill with full myelosuppression and a failing liver. We all understood it was a huge medication error, but the doctor never told the patient and family about what was going on. He relayed it all as inexplicable. The family couldn't understand how someone was dying from a psoriasis treatment. As nurses, we weren't allowed to pass judgment on any medical action or offer an opinion to the family about what was happening. But one quiet evening we made steady eye contact with the patient's son and simply said, "You need to get a lawyer." I was doing a corneal transplant when I had the "oh shit" moment. During surgery, I cut off the patient's own cornea and replaced it with a new donor cornea. During that moment when the host cornea was off but before I could get the new one on, there's literally nothing on the front of the eye except a tear film and aqueous humor. Anyway, the patient takes that moment to start vomiting. The reason we tell everyone to skip food and drink is so they don't aspirate in case they throw up. This patient lied about eating breakfast and started throwing up everything. The eye is still open sky at this time. Everything inside of the eye can now become outside of the eye, and she's bucking and vomiting. Those not in the know will say this is not good. Those really in the know will say, "Oh shit." Anyway, I had to grab the new cornea and start stitching as fast as I could on a patient actively throwing up. I used 10-0 nylon sutures which are thinner than an eyelash. It turned out okay, but not great. Don't lie about eating breakfast before surgery, folks. Doing a cesarean section for this poor mom who'd been in labor for hours. Baby wouldn't come out of the hole we'd made, so more pressure was applied to the fundus, top of the uterus, and suddenly whoosh, baby zooms out like a torpedo, covered in lubricating vernix. Zips over the surgical sheeting which has the texture of a slip-end slide and almost rockets straight off the table. The baby's foot was caught by the reg, who whipped her up in the air upside down like in old cartoons, but almost dropped her again due to gloves plus vernix. Thankfully, the midwife was ready with the towel and caught the baby to wrap her up. Mom and Dad seemed to think this was normal practice and didn't notice, but me and my colleague just stared at each other with a look of absolute horror. It still makes me shudder to think how close the baby was to hitting the floor head first. Never happened before or since. Happened at my hospital. A mentally ill young woman, who was pregnant at the time, was in denial, locked herself into her room when she realized the contractions were coming. She basically didn't push and the baby didn't come naturally. Her family called 911 because of the smell. The ambulance realized her baby had died inside her and was basically rotting due to the smell. She was taken to the operational to remove the baby, and apparently all the nurses and surgeons were vomiting because once they opened her up the smell was overpowering and it was traumatizing to see a rotting baby. Not a surgeon. I'm a hospitalist physician. Justin Medical here. I was working in the emergency room and had a patient brought in by her husband. Apparently the woman had a fall a week prior and injured her face but refused medical care. Her husband finally forced her to come in. As soon as I see the wound on her face from across the room, I think, that does not look like any wound I've seen. I approached her and realized maggots had infested the wound and were eating the rotting skin. A really simple and quick fix, but I can't imagine her living conditions. My dad said he was once using surgical glue on a patient on a chainsaw accident. On accident, he glued his glove to the patient's stomach. He said he laughed for a bit, then apologized when he left to get solution to remove the glove. My mom is an ambulance surgeon. About 3 years ago, a car crash victim came in real early to the emergency room. He had a wooden block logged in the side of his head and the windshield shattered all over his face and neck. My mom saw him and was immediately determining how to fix him up, and she decided to start with the wood. Her oh fuck moment came when she saw the wood had penetrated through the mouth and down the throat. Unfortunately, the man passed away a couple hours later, but my mom did her best to try and remove the wood, but the damage had already been done. I suppose this is relevant. My ex told me this story where her best friend studied to be a veterinarian at university. During their course, they're obviously taught about how to deliver baby animals. Part of their practical studies involved being taken to a farm, a field trip if you will, and to see firsthand what delivering a baby animal is like. Basically, a girl in this class walked up to deliver a kid baby goat, and instead of easing it out of the mother goat, she pulled on its head, and because of some partially undeveloped tissue, its head came off. My father was a gynecologist. He had a lot of different stories, but there is one thing that stood out. Apparently, he once delivered a mermaid baby. Let me explain. He noticed pretty early in the pregnancy that there were things wrong with the baby, but he couldn't really pinpoint it. It bugged him very much. He was a very good doctor, so he looked in books and online for everything that he could find with those symptoms. So apparently one of the possibilities was a deformity that the legs of the baby grew together, creating the illusion of a mermaid. Apparently it's something that only happens on very, very rare occasions. The main problem was that not only the legs but also some of the intestines were grown together. So when the baby was born, it only lived for a few hours. I'm currently in med school, and this happened a few years ago when I was attending surgery classes. One patient was up for a laparotomy for removal and investigation of an abdominal mass, probably cancer. Imaging tests were really not specific or of much help, as this was some atypical disease presentation. Even specialists couldn't figure it out. To everyone's surprise, the patient's cancer was really a forgotten gauze from some previous surgery. The actual moment of realization went as the surgeon just stopped and said, "Gauze." To which the nurse promptly gave him one, and he went. No, there was a gauze inside of him. My father is a physician, and although he's not a surgeon, he did some surgery while in med school. He told me a story about a patient he had once, who had necrotizing fasciitis, or flesh-eating disease. The patient had gotten a cut during gardening and never cleaned the wound. My dad told us that he had to peel back layers just to get at it. First, he peeled off the bandages that the patient self-applied. Then there was a layer of holy book pages that he also had to peel off. Following that, there was another layer of bandages, and then a final layer of more holy book pages. Beneath that, there was the wound itself, which was covered in maggots. Apparently, they were eating the dead tissue generated by the disease. He said that once they removed the maggots, they were able to begin the surgery to remove the infected areas, but it was because of the maggots that they didn't have to amputate the limb. After this operation, my dad decided to not pursue surgery and focus on becoming a specialist. Obligatory, not a surgeon, but a student assisting in the operating room. 65-year-old guy with kidney problems, possibly cancerous, needed to have a chunk of his kidney removed. Okay, no big deal, we give him meds, knock him out, then prepare to operate. We removed his gown and everyone in the room froze. One of the surgeons actually said, "Holy fuckballs," which is relatively accurate. Apparently our guy had some muscular disease that caused a massive abdominal hernia, and his intestines were herniating into his nutsack. His scrot was honestly about the size of a deflated basketball. Then there was the time we had to amputate a lady's leg that was riddled with gangrene. I was with the nurses cleaning the patient for surgery when the surgeon came in to check on us. One of the nurses pressed too hard on a dressing and it popped a blister full of pus across 2 people. Everyone screamed, then dry heaved at the smell. Fucking horrendous. My father is an ambulance doctor. Old woman comes in with a headache. Attending sees her, sends her home with some Advil. You can tell where this is going. She comes back 2 days later with a stroke and chest pain. It is a massive stroke, so they get her on blood thinners right away. They send her in for a tomography scan to check out her brain. Basically just neck and head. On the scan they notice something odd. You do another scan. Her aorta has almost completely dissected. This is the most blood-filled, high-pressure artery in the body, and blood thinners are the absolute last thing that an aortic dissection patient should be given. Commence freakout. They wheel her into emergency surgery to repair the aorta, but by then she's bleeding into her pericardium. Her heart stops shortly thereafter. Luckily, my father never personally prescribed the blood thinners, but apparently that was a real. Oh shit. Moment. Her condition was fatal either way, but it was not a good day. I had a hernia as a kid, and the dude cut the wrong thing. Apparently he said, "Oops," and then finished what he was supposed to be doing. We aren't totally sure if I'll be able to have kids now. Thank you for watching this video to the end. Write your similar stories in the comments below the video. And also be sure to subscribe to our channel to not miss new super interesting videos. and I advise you to watch our other videos.